We're going to talk about sexual and reproductive health today. Sexual and reproductive health, more than just knowing when and how to use condoms. An estimated 19 million new cases of sexually transmitted diseases are diagnosed each year in the United States, almost half of them among young people 15 to 24 years of age. An estimated 1.1 million Americans are living with the human immunodeficiency virus, or HIV, and 1 out of 5 people with HIV do not know they have it. Untreated sexually transmitted diseases can lead to long-term serious consequences, especially for adolescent women and young women, including reproductive health problems and infertility, fetal and perinatal health problems, that is, health problems around the time of pregnancy, cancer, and even further sexual transmission of HIV. For many, reproductive and sexual health services are the entry point into the medical care system. These services improve health and reduce costs by not only covering pregnancy prevention, HIV and STD testing and treatment and prenatal care, but also by screening for intimate partner violence and reproductive cancers, providing substance abuse treatment referrals, and counseling on nutrition and physical activity. Each year, publicly funded family planning services help prevent 1.94 million unintended pregnancies. That is close to 2 million pregnancies, including 400,000 teen pregnancies. For every $1 spent on these services, nearly $4 in Medicaid expenditures for pregnancy-related care are saved. Improving reproductive and sexual health is absolutely crucial to reduce and even eliminate health disparities, reducing rates of infectious diseases and infertility, and increasing educational attainment, career opportunities, and financial stability. Reproductive and sexual health is a key component to the overall health and quality of life for both men and women. Reproductive and sexual health services can prevent unintended pregnancies. Nearly half of all pregnancies are unintended. Risks associated with unintended pregnancy include low birth weight for the newborn, postpartum depression, delays in receiving prenatal care, and family stress. These services help prevent adolescent pregnancies. As I said earlier, more than 400,000 teen girls aged 15 to 19 give birth each year in the United States. These sexual and reproductive services help detect health conditions early. Prenatal care, for example, can detect gestational diabetes or preeclampsia before they cause problems, major problems. And taking prenatal vitamins can prevent birth defects of the brain and the spinal cord. Using these services helps increase the detection and treatment of sexually transmitted diseases. Untreated STDs can lead to serious long-term consequences, health consequences, especially for adolescent girls and young women. Using promptly these sexual and reproductive health services helps decrease rates of infertility. The Centers for Disease Control and Prevention, the CDC, estimates that undiagnosed and untreated STDs cause at least 24,000 women in the United States each year to become infertile, to not be able to have a pregnancy and progress with the pregnancy. These services also slow the transmission of HIV through testing and treatment. People living with HIV who receive antiretroviral therapy, which is the therapy to kill the virus or to keep it at bay, are 92% less likely to transmit HIV to others. Accessing health and reproductive health services is fundamental for the well-being of communities and their growth. Not only government agencies, but also many nonprofit institutions are committed to the promotion and provision of reproductive services. These are the 5 things I want you to remember about sexual and reproductive health services in general. For many, they are the entry point to the medical care system. They are key components to health and quality of life. Third, they improve health and reduce cost. Fourth, they help eliminate health disparities. And 5, they help prevent infections and help treat them early.